and struggle. Oh, well, that's practice. No, okay, yeah, they just. Well, yours off. Doesn't apply. The sound of that. And then I think you guys. Now you got anything else yesterday. Are you so loud?
No, I would never.
Literally.
Oh, that's. I
love it.
Yeah.
I'm so. Thank you guys enough how much you guys support us.
Oh, yeah.
It's been wonderful. It's nice to meet people that I like. We are good pipeline for you.
Yeah.
So,
I don't want pipeline to wonder.
I just, I love you talking.
All right, class. So one, I want to thank everyone for attending this session today, especially those folks that a lot of my counterparts from Lee Health are here. So, but anyone who's not with Lee Health, thank you for attending. I really appreciate it. Today, really want to highlight really the increasing importance of cyber in healthcare. Right, I think out of all sectors, it's most important. I'm going to talk about why. I think that we probably get prejudiced because of what we do as part of our industry and the responsibilities we have. Quick bio. My name is Zegers, Information Security Officer at Lee Health. If you're from this area, which I think most people are, but if you're from this area, Lee Health is one of the largest employers, about 17,000 employees. 5 hospitals, 125 plus practice locations, right? So cancer centers, specialty practices, freestanding ERs, large facility in Coconut Point. We're constantly building new locations. We have a new hospital going up on Challenger near Colonial. There's new buildings. One actually a large Bimini Square location in Cape Coral just opened, I think in the past week. So constantly growing and expanding the footprint. And so I have, over 25 IT experience, been in this position as information security officer for a little over 7. Prior to that, was director of infrastructure, data center infrastructure services for the organization. Again, been at Lee Health for a really long time, so 20 years now. I oversee all cybersecurity related activities for the health system. So policy management, risk compliance, and work a lot with our technical folks who have innovation for what they do in managing and securing and using our security controls that we deploy for the organization. Also, bachelor's of science in electronic engineering technology. So we were talking about the semblance of these badges. I've not used a soldering iron since I got that BSWT degree, so you're not let me doing any soldering, anything. Agenda of what I'm going to talk about is top cyber risks to healthcare. Why are these the top threats? Obviously, ransomware, you can't talk about top threats, but talk about ransomware. I do not plan to talk a lot about AI, so that's the other term that's like Emily, don't worry about using AI. I'm not going to do a lot of those, I think you've heard enough about it. But why ransomware has such a severe impact on healthcare? Again, it's very different from the business that we're in and the impact something like ransomware has to our operations. So when that occurs, also highlighting a Sentinel healthcare event that has been discussed in a few other sessions I've been in, but really this is one of those unplanned for, unthought of. This organization may be too big to fail, and then nobody thinks through the underlying repercussions of what happened. Critical service providers has an extended outage and what that does on a national scale. Also, what can we do to address the risk? And at the end, we talk about various cybersecurity roles and really what you should be doing to get started in them. If you're interested in them, if you're not already in cybersecurity, you're in it, you're kind of wondering where do I go from here? We'll cover some of that. And also we'll have room at the end for questions. If there are questions in between, feel free to let me know. But I want to start off with talking about why healthcare is targeted. Right? Why are we the top industry being targeted out there for cyber events? we really valuable data. When you talk about PHI, protected health information, there's a ton of value in that. Specifically because if you look at something like a credit card number, why would a credit card number only have a few dollars worth of value and something like PHI could be hundreds of dollars? Because I can make a phone call and cancel that credit card number right now. It can't be used anymore. But if you have my name and date of birth and social and medical history, can I cancel that and get new ones? Right? Like, no, I cannot. But what can you do with that information? Right? I can go open up a new loan. I can open up credit card in somebody else's name with that information. I can file fraudulent tax returns, right? All the things that are constantly happening to people probably have happened to people in this room. I have had that happen to myself a number of years ago, right? Like it's really hard to prevent that from occurring once your information's out there. That's why it's so valuable. That's why they want it. Life or death urgency. So this goes into, again, the line of business from healthcare is we typically operate in a zero downtime environment, right? It's really difficult to get approval for downtimes at a healthcare organization because it impacts patient care, whether that's 2 a.m. or 2 p.m., right? It's still really difficult. Those of us that are, in the room that work in health understand this, right? Like the approval process you have to go through and why it's so complex is because the impact downtimes have. And a lot of times we're talking an hour downtime or less, right? So if I've got to go through the ringer to get an hour of downtime, now, think about what that's going to mean when we start talking about ransomware and we're talking in weeks instead of hours of downtime, right? Again, this is why it's so. Attackers exploit this, right? They know that we are heavily reliant on our IT systems to operate our business and to provide patient care. And when those systems are down, there is an impact to patient care. So they use that to say, okay, we know there's pressure on these organizations to pay the ransom. Minute one, right? To get these systems back operational and get their data back. So they leverage that quite a bit. We also have complex IT ecosystems, right? So this is legacy systems, unsupported operating systems, devices on the network that are unpatched and unsupported, complex configurations and implementations. Many health systems do not have a very centralized clinical or business application list, especially as you think about as sites are acquired, right? We may be acquiring a new organization, they may have a different electronic medical record system that we do. Now all of a sudden we're supporting 2 or 3 or 4 or organizations that support 20 or more when you get into big healthcare orgs, right? Integrating those all together is very difficult and maintaining and supporting them is even more difficult. Healthcare vendors, I would also say, are not at all on the leading edge of supporting new technology. Which is why when they talk about medical devices being such a security concern, and we've heard about that, right? They're really lagging. And when you get into even just clinical systems, the same thing. Vendors supporting the latest operating system from Microsoft typically is 2 years into that OS being released. So now you're already behind the 8 ball and trying to stay in front of support end dates because you're waiting on vendors to sign off on support before you can actually move that forward internally. This is the complexities of what we deal with. Third-party vendors, supply chain connections. This is one of really one of the big, huge risks that I'll talk about on an upcoming slide. But third-party vendor risk management is one of the main areas that we deal with, and on a multiple times a day basis that I'm having conversations and discussions about at our organization, and many other healthcare organizations are trying to deal with this also. And then very last, we have underinvestment in cybersecurity. So again, from an industry standpoint, healthcare hasn't been the best at investing money in approving funds in cyber, right? It's been looked at as like, hey, we haven't had a problem yet. Why do we need to spend all that money? Or we have medical equipment that needs to be upgraded. That is going to take priority, right? That's really hard comparison to say, no, you should invest in some cyber controls and not in technology that's going to help save the patient's life. Again, what's the business we're in? We're not in an IT security business, we're in a healthcare business. that always takes priority. So you start to look at large health systems and all the way down to small clinics and private practices where their investments have been very minimal on the IT infrastructure side, which also impacts cybersecurity, right? When you go 7 years before you replace network gear and IT infrastructure, that should have been replaced at within 4 years, right? You start to have vulnerabilities, leads to this complex IT ecosystem that I mentioned, right? Like those sort of problems. Patching, monitoring, all the complexity that come along with not maintaining and investing in core IT infrastructure and security tools. So the top risks to healthcare, right, may seem pretty obvious, but phishing continues to be the top risk for most organizations, especially ours, right? When you look at we block 80% of email right off the bat that comes in, right? So all that's blocked as spam, bulk, and threats. Really hard to prevent and get 100% block rate. Anybody work at a place where they block 100% of all email threats? Has anyone heard of a product that blocks 100% of all email threats?
No.
Right. So when you're talking about organizations receiving millions of emails, 1% or 0.1% still translates to hundreds or thousands of threats that are coming into end user mailboxes, right? This is still an issue we're trying to deal with. And then the other thing I want to highlight there is it's really easy to talk to people and say, well, look at who it's coming from. Is it expected? Look at the URL. Is it an unknown attachment? Right? The things we've been preaching about for years to our staff. When you have compromised known contacts, this adds a whole new layer into that. So we have been seeing that much more over the past 12 and 18 months, right? An organization we're dealing with that may be right down the street that our folks talk to every day now is sending them a phishing email with a threat. So how do they figure that out, right? Because there's automatic trust. Hey, I know Mike. I talked to him all the time. He just sent me this email and said I need to click on this link, right? All the things we've been telling them to be careful about, like they don't even think about because I know that I talked to him. Why would he be sending me something that would be that? Not thinking about the mailbox is compromised. So this is something that's a whole new layer that we've been seeing quite a bit in the house because of our involvement and association with other organizations, even ones that are horrible. Ransomware is the other top threat. Really, phishing typically is a precursor to ransomware, right? That's how they're getting access to the environment. But because of the impact ransomware can have in taking systems down, typically you're down for 3+ weeks, right? That's the average downtime of systems, right? It has a huge impact on organizations. So not only the financial cost, but having no IT system for that long time can really impact operations. And then third-party data breaches. So this is probably the other thing, as I mentioned, we deal with quite often because we have very little control in this area. Right? Most of the other things, we have protections. This is kind of our internal network we're dealing with. So I have a lot more control over what I can put in place, what we can do, how we respond, what visibility we have. This is saying, take a big chunk of your data and give it to somebody else and let them hold it for you. And hopefully they do all the things that you're doing. Right? And hopefully they tell you if something happens in their network. And hopefully, right, like all these things other happen. So this is the big key area because especially as all these vendors are cloud hosted. I've heard so many times in sessions, even the session we were just in that talked about PII of unsecured cloud storage locations, right? You gave it to the vendor, they don't properly secure their cloud storage. Now your data and a lot of other people's data is all impacted and affected. Happens all the time. Like if you guys follow it all the news about every day, reading about a third party. So why is phishing the top threat? I talked about the volume of data. So when you're talking about estimates of over 3.5 billion spam emails a day, right? That's insane volume. And the criticality that emails being used as one of the core communication platforms too, right? That plays into it. You can't just say, well, hey, we joke around and say it'd be really easy to address phishing by saying, let's just cut all email. But email is how people communicate. The business can't operate without those core channels, right? So it's like saying, well, let's just not have internet and then hackers can't break in. Great, okay, it's not gonna work, right? But Google blocking 100 million phishing emails a day. Again, these are stats I had pulled a little bit ago, so it's even more than that now. You know, 2022, half of the emails were spammed. Half of them. 20% of phishing emails coming from Russia. You know, they talk about now running cyber attacks come back to phishing related as that initial entry vector for threat actors. Right, this is why it's one of the top threats. When you're saying so many of those other things I mentioned start with phishing, third-party breaches, a lot of times start with some phishing email on the third-party side. Ransomware starts with phishing. You know, 82% of people use one password for multiple accounts. That's really accurate, right? Because if you look at how many breaches have happened with passwords, there's billions of passwords now that are known from the breaches. So they can take that data and analyze it and say, we know what end user tendencies are. 82% of them use the same password. It's very frequent for somebody to capitalize the first letter and put a number at the end, right? Like the things that we've known people are doing, the data now is out there through breaches to confirm all these type of bad things. So threat actors are able to use that to improve their processes and now have a much smaller data set they have to use when they're trying to do brute force attacks or password guessing, right? Like they know what the tendencies are. If I have any of your previous passwords, right now all of a sudden I can make a really educated guess as what your current password is. If people just change it from a 1 to a 2 to a 3, every time you change the password, which a lot of people do, which we know because the data shows us that. When we talk to people, they confirm that this is what they do. Right, so now all of a sudden, well, I can have a 15-character password, but if I'm just changing the last number and encrypting it by 1, is it really more secure than an 8-character password?
No.
That's the issue, is passwords are known now, right? So it's the whole thing around password management is really difficult to try and get people to understand the why it matters and why some of these things are so critical of having unique password equipment. Human element involved in so many, right? Verizon talks about almost 70% of the times human elements involved. But why is ransomware so dangerous? I mentioned about 3 weeks average down, 23 days. That's huge. I was just talking about how hard it is to get a few hours of downtime. I can tell you, our organization, if that downtime goes more than 4 hours, it's a whole different layer of how they respond. That's 4 hours. Not 23 days, right? No one is prepared for a 23-day downtime. And this is, we're talking about typical downtimes. We're taking an individual application down. This is a complete network downtime, right? I might as well just go pull the plug to the data center. Phone systems, internet, our EMR system is going to be down, right? Pharmacy and lab, we talked about implications of those physical security systems. Now, I'm swiping my badge at the door to get in, that may not work because the system that controls that is now down. The payment systems, ordering systems, scheduling, right? OR scheduling. Now, if the payment systems are down, what can that impact? Collection of funds for the health system. So now revenue is going to be impacted. What else? How do we get paid? Anybody else want to not get paid for the dreams? I don't, right? Like these are all like big issues that play into such a long extended downtime of why it has such a big priority and impact to the organization. Manual processes increase error rates, that last statement. Right? It's proven, data shows when healthcare organizations have an outage related to ransomware, have an extended outage, right? There's an impact to patient care. You have error rates occur because now you have systems you're relying on providing data that aren't there functionally. Right? So I can't tell what your previous medication is. I don't know what happened when you were in the ER last week. I don't have that data. Person may not even be in a state to be able to respond and provide that information to the caregiver when they come to the health system. These are huge things that impact the organization. Talking about increase in ransomware going up 45%, just in the second sector of the year, more than 2.5 times. 36% of hospital systems have complications. This is something that isn't slowing down, because again, why is it impact to healthcare so critical? Because all of this right here, this is what plays into it. Who here remembers going to see the doctor and then having a paper chart? No, it's all right, right? Very few, right? Okay, right? So this is the same in the workforce, right? So we can say, well, if your systems are go to paper. Okay, when 10% of our work staff, they're about maybe 20% have actually remembered doing that. And the other 80% have never used paper at all in their life, in their career, right? That's not an easy answer. You have people that like, we used to do this before, it's easy. If you've done it before, they had a whole lifetime of dealing with those processes that other people, other generations in the workforce have never even heard of or seen before.
Same thing with prescription delivery and
Yeah,
anesthesia,
So-
they can't do the math anymore.
so from an education standpoint, when preparing them, right, you have people that remember, like, I've done this before, I know what it's like, I got this, people are like, I've never had a paper chart before, but I've never even seen someone do it. This will be the first time they're having to do it, when all the systems are down, and now everyone's looking at it, it's like, okay, what's going on, how are you gonna take care of the patient, right, that's not what needs to happen. But that's what we get to deal with. So the clinical impact for ransomware. You know, we have this highlights on the event where, 150 plus hospital system had to go to manual systems. You're talking about diverting patients to other healthcare systems when this happens. Unable to fill prescriptions, right? Like unable to process pharmacy claims. Now all of a sudden, we can't send your medication to the pharmacy anymore for them to automate it. They also can't potentially determine what your coverage is for pharmacy medication, which I'll talk about. Right? That's a whole problem. When imaging systems are down, this is a problem, right? Because right here, remote radiologists. So a lot of people here may work remote. I know within our health system, most of the support services folks are remote. But we have physicians now working remotely. Most of our radiology reading is done remote. So if all the IT systems are down, how can they read the studies? They have no backup. Somebody has to come on site and read it from the actual modality, the diagnostic imaging device, right? Which used to be much easier when those folks were already on site reading. Now that's all off site. We have telehealth, we have hospital at home service, so many virtual services now. To where if you take away those tools and that connectivity, how's that happen? Right? Remember now we're very much more reliant on the IT systems and the connectivity for these clinical processes to take place. Risk to patient safety, delayed emergency care, right? Cath lab, heart attack diversion, clinical systems unavailable, revenue interruption, right? Potential no income for weeks or months. That some systems can't sustain it. Some systems will close if they have this right here. They will go out of business. They have. Right. Cancer treatment plans being affected. And surgeon patient volumes of nearby health systems. So this is another kind of lost fact of let's take into account the health, right? We have 90% of the market share in this area. So if our systems are down and we have to divert patients, where do they go? Right? They go to Naples or they go to Punta Gorda or Port Charlotte. Well, what's the capacity of those health systems to be able to take that patient flow, right? Now we're not just impacted, now that's impacting other health systems that aren't even affected by the, they're not having a direct impact by the outage, but the patient flow and diversion can have an impact there. So you have this trickle down impact of, again, why ransomware has such a large impact to healthcare as compared to other industries. So many of them are really connected, right? If you even talk about look at how healthcare systems are in Tampa. You have a lot of options there, right? But if one of those is completely down and they're diverting, now all of a sudden you're pushing a huge volume of patients into a health system that may already be at max capacity. So now how do they handle that? Right? Lots of implications. So Sentinel event. Right? Change healthcare. Is anybody heard of that? Not the health people. Anybody else heard of that? Change healthcare event happened early last year. And so Change Healthcare slash Optum slash United Healthcare. So it, got acquired multiple times, ended up being owned by United Healthcare. So you may hear it as United Healthcare, but it's changed at the time. They have a ransomware event in February 2024. All health systems found out really quickly that they were down, right? Because it was so integrated in some of the core processes for healthcare systems in the US nationally, right? 15 billion healthcare transactions annually. Their systems touched 1 out of every 3 patient records. Beforehand, I don't know that anyone would have calculated right that. So this gets into the third-party risk, supply chain risk, right? This is a supply chain risk issue of some core vendor and supplier, their service is going down, and then now all of a sudden you have this massive impact across the nation, or even, I mean, this affected customers around the globe, but in US, it was significant for healthcare organizations. Services were down, their services changes were down for minimum of 1 month, 2 months. There was a number of them that even came up after that time frame. They were able to get many of their core services done. They were rewriting code to applications to get this back online. Redeveloping code to their systems to get that back up. Like, right? Like, think about that, like the impact of that, the risk of that, the effort that has to go through to bring those systems back up. Threat actors stole at least 6 terabytes of data, right? Change came out and said, we paid a $22 million ransom. Is that a lot?
Yeah.
Is it? Because they said this incident cost them $2.5 billion. I bet those threat actors like, why did we only ask for $22 million?
That was fake.
Right? They came out in their SEC file and said, this is going to cost us $2.5 billion over. Massive, right? So this is why it's a sentinel event. It sets precedents for, if I'm a threat actor, why wouldn't I look for another Change Healthcare? Look at the money I can look. Now that this is known, a big organization, wouldn't they pay me $100 million? Pretty easy if they know this is going to cost them billions of what Change went through, right? Like, like that's going to happen. You got to have. We're going to see that more. We're targeting those top level tiers that people aren't even thinking about the impact it can have when they're down, right? Because the cost of the organization is going to say, the creditor's going to say, I can get a $50 million ransom pretty easily, right? Smaller organizations, that's going to be very difficult. Something like that, where they're talking about losing $2.5 billion, right? They write that off every day. Right? Because financially, to get the systems back online, if it costs them $20 million, they're going to do it to prevent losing $2 billion. Right? The financial decision, that's really easy for them. Cause of this, lack of multi-factor. How long have we been talking about MFA on systems? How long? Right? Like complex IT ecosystems, right? Acquisitions, legacy platforms, not having that done on some of the systems, right? These are vulnerabilities. These are things that health systems have to deal with, and vendors have to deal with. They came out, and this is recent. I think just past couple months they've updated this number to what it is. Originally they said, yeah, we think there'll be at least 10 million people impacted. I said, sure, no way, right? Then they came out and said, okay, about 100 million people impacted. And that might be more in the range. Then they said, okay, it's 192.7 million people impacted, right? They sent out 130 million notices. Who in the room got a notice and an email from them, right? Like, it should be at least a third of us, because my hope, at least within our health system, pretty much everyone got it, right? Because again, they're so ingrained to all healthcare organizations. So just think about the cost to send out the notices, to coordinate that and send out the notices for that, right? And this $2 billion is recovery costs. This is loss of revenue. This doesn't even counter in the money what they had to eat for organizations that couldn't properly verify the drug coverage, right? Because they do basically pre-authorization. Hey, if I go to pick up my prescription at Walmart, what is my coverage for whatever medicine I'm picking up? Right? If it's a $500 medication that I only have to pay $25 for, they can't verify that when this system's down. right? I'm not paying $500 for it. So what happens when those verification pieces didn't happen? Is United had to have significant, I think it was in the 9 billion that they lost for covering organizations that and pharmacy prescriptions that were written during that outage that couldn't be verified. And the source, the pharmacy locations aren't gonna beat that. The patient, I'm not paying that because the systems are down, it's not coming out of my pocket, it comes out of their pocket. 74% of hospitals report direct patient care impact. 94% reported financial impact from this event. 94% of hospitals, right? Again, this is why this is a sentinel event. This is why ransomware in healthcare is like in the news all the time, and why we worry about all the time. This is the worst day we are going to get to deal with if it ever happens, right? What do we do about it? So actually I was in a couple sessions too where they already said, there's no magic silver bullet for this. That's exactly right. If there was a system we could put in, a change we can make, something we can invest in, and we don't ever have to worry about this again, we would have done it. Everyone would have done it. It's not one change, there's not one system, there's not one investment. Complex ecosystems, there's so many layers to this of how it can happen. So when you talk about that onion of cybersecurity, where you have all these layers that threat actors have to get to. Common things, anti-phishing controls and training, right? Make a lot of sense, we know that. That should say EDR, with my mistake, EDM. You like the music, right? It should be EDR. Security orchestration, right? Let's help minimize that window that threat actors have access or something's available. Security orchestration helps you shorten that time frame down to remediation much quicker than manual processes. MFA, obviously, right, like that. It's on the list, but they come on, I just highlighted why the other systems have. Pen testing, right, getting verification through an external party, right? Whether that's internal, whether that's third party people that specialize in that, right? We should be checking the controls. Zero trust network segmentation. I think that's such a general term, right? But so many things fall into that. Network access control, and segmentation is really where it's difficult to do, especially on a hospital network when you have complex systems. But that's where you can start really layering controls of I'm going to block communication that shouldn't be happening. But you have to know what should be happening to be able to put those blocks in also. It gets very complex. Third-party risk management, having processes in place, having tools in place to be able to track that properly, identify risks, sign off on risks, and then continuous monitoring. Incident response preparedness. So even though we don't ever want the incident to happen, we're preparing for it, right? Just like we do for hurricanes. And we go through hurricane preparedness. We go through cyber incident preparedness. Go through the response plan. Let's pretend this happened. What needs to take place? Kind of building that muscle memory for folks to where the first time they think about it isn't when they're having to read the instructions because we're in the middle of an actual incident. Right? Getting them comfortable with that. Information sharing. So we just if you guys, anybody was in the HISAC meeting just earlier, right? That's really important. There's a lot like threat intelligence is huge, and ISACs are a really good way to be able to get current threat intel. Right? Most of the time, I don't have to wait to read a website or check my emails from vendors. The HISAC portal, people will be posting already. There's a 0-day impacting Windows, and this is the patch. As soon as it happens, right? So those channels help expedite that communication and intelligence so much faster than the traditional methods that are out there. AI defense threat protection, like this is a big area that's coming in again of think about kind of advanced user behavior and analytics, right? AI can really do much better job of UBA type activity than old school UBA tools that were very noisy and require a lot of tuning and missed a lot of things and created a lot of noise that really ended up being false positives in the system. IoT security. So I mentioned, we have about 20,000 managed connect devices on our network. 20,000, right? Any guesses? Lee Huff can answer this. Any guesses how many total network connected devices are on our production network? Yes. 100,000.
That's really fascinating.
100,000, he said, right? It's really closer to 50, right? But I said we had 20,000 managed devices, so more than half of the network connected devices are not managed devices. Right? That's why that's a concern, that's why something it's worried about. How can that be, right? Like, that seems crazy, you're right. IV pumps, right? There's thousands of IV pumps connected to the network. Smartphones, VoIP phones, security cameras, door control systems, televisions in the patient room. What else? What else am I missing? That like we have just a ton of unmanaged devices sitting on the network, and every week we're getting requests from areas to connect network connected devices that have never been on the network before. So there's a big drive from vendors to start getting network connectivity to help create efficiencies and integrations that now require devices to be on the network that before sat standalone, never got updated, never patched, and now the vendor's like, hey, just plug in the network cable and we can do all these great, wonderful things. Right? But from a security standpoint, who's got to worry about it? We get to deal with that. Right? That's why it's such a big thing to deal with. Cloud posture management, like keeping an eye on cloud services, making sure they're configured correctly. Right, having core change management processes is critical in so many of these things because with complex systems, you're making a lot of changes and they don't always have the intended impact on systems. So you need monitoring to make sure what is in place is still there and configured appropriately as best practices. Post-quantum cryptography, this is coming along, right? That's going to end up being an issue. We're like, yeah, great, we encrypt data in transit, we encrypt data at rest. It's really hard to break that. Well, at some point, it's not going to be really hard to break that. I mean, technically, if you have the tools that you could do that now, right? But it's really costly. At some point, it's not going to be very costly and it's going to be really easy, which means crap. What are we going to do? Complexity in cyber also, right? Like, so we have cyber skills gaps. We have AI and emerging technology, right? We can use these for good things on the security side, but there's also, we see a lot of risky things that the business is wanting to do with AI, right? Everybody just wants to put their data into ChatGPT, and if that's an employee list, if that's salary information, if that's PHI, nobody's thinking about that. They're just like, hey, this can summarize it for me and do all these great things, but not really think about where the data is going and who has it. We have regulatory requirements, talk about supply chain concerns. Obviously, cybercrime sophistication, we continue to see, you have the gamut of really basic, in one of the sessions was talked about targeting of IT help desk, right? Really basic. I'm just going to call the help desk and ask them to reset my password. How much more basic can you get than that, right? Like, it's not always a really advanced phishing email that they've targeted you, done research, and created a website to try and spoof another authentication site for the organization. Sometimes it's just them picking up the phone and saying, "Can you reset my password?" And it helps us, right? Who's typically graded on first call resolution and time to resolution. And for as long as I can remember, that's what they're held responsible for. Now, like, why did you do that? You should have asked more questions. You should have escalated. But right. It's really easy to say that. Yes, we have processes in place, but also there's core things that lead to why these are problems that we deal with, why you hear about them, and why it's a struggle, because we have these legacy ways that measures are created, right? That there's teams that have metrics they have to meet that go against what we want them to do from a security standpoint of like, hey, stop and think. Hey, ask questions. Hey, escalate this, right? That goes against the metrics they're measured by. It makes it really difficult for them. Those are like conversations and like changes in processes that have to take place over time.
Quick question.
Yes.
Do you guys handle a lot of this stuff in-house, like such as penetration testing, like any help?
Some of the things, yes, some things that, so specifically pen testing, we use third parties.
Oh.
Because penetration testers are a really specific skill set. Hard to find for us, like attracting talent. It takes us a long time to fill positions, especially specific skill set positions like that. So we go through third parties where that is what they do. That's all they do. They specialize in it. We typically do them more as a purple team exercise, just so that can help expand our team's knowledge when we do it. Because we want to kind of see, What are you doing? Are systems detecting it? Did we block you? Something get missed along the ways? I don't want to just get a report at the end and find out, oh, here, you found all these things, and now we're trying to figure out what happened in between, but. It depends. Pen testing, yeah, we will use third-party experts, risk assessments, we will use third parties. We have to in some areas do that. As much as possible, we will do this in-house and contract out when we need extra. Yes.
To expand on his question, actually, I just made me think of something like that. It's something I see in hospitals a lot, is like RFID. People use a lot of RFID badges, things like that. Who would handle something like that if somebody was trying to penetration test like your RFID? Somebody's trying to clone or use like a key card that somebody found or create a copy of it.
Who would handle the response to it?
Yeah,
Is it
exactly.
something like that? It would be a combination of both our, so this is where. Physical safety for us, public safety, falls under a different team that owns that.
Right.
If something were to happen, we have those integrated into our systems too, where we're getting some of that logging, hopefully can identify it.
Mhm.
But we're seeing where in a lot of other organizations. Physical safety is starting to fall under the realm of a CISO role.
Okay.
Because it's security, it's
Right.
physical security, it's not just data security, network security, it's
Right.
security.
Right.
So you're starting to see that more common being pulled into the same group from the management because it's not always kind of being addressed and thought of in the same relation to data security, though it should.
Right, exactly.
Yes. Yep. Cyber careers. Right, so I just want to highlight that. Because we get a lot of questions on this, and I think it's really important because when we talk about, you know. People are maybe looking to get into cybersecurity. Maybe they have a role and trying to figure out where do I go from here? What are my options? Right? This is it really when you start to get into the roles, you start to see some of the more specialized areas and opportunities. I think so. You security analyst, top one is probably one of the more common roles, right? You have network professionals, you have people specialized in cryptography, malware analysis, pen testing. Identity and access management is a big area. Cloud security is a big area that's growing. App security is a big area that's growing. Security architecture, right? The folks that are designing the actual platforms. How are we going to implement the system? What system do we implement? Right? You have people doing that design work. For us, this is where a lot of the kind of roles fall into. But kind of looking at that saying, what are the ones that most in demand, right? What is everyone looking for? Cybersecurity analysts, ethical hacking, right? Security architecture, incident response, cloud security. Right. I'll tell you, this one right here is really hard to find people that know well. We did find one, right? Took us a year to fill that position. 12 months, right? Not easy to find. Expected job growth, right? Talks about 31% expected job growth in that. Right? This is an area that continues to grow. Years ago, I would tell people if they're doing kind of IT technology like data center or infrastructure, that there's going to be less of a need in 5 years for that. Right? That was years ago. Now we're getting cyber, and everyone's getting cyber, but there's specific areas where if you specialize in it, right? Some of these core areas, right? You're setting yourself up for long-term success and a need in cybersecurity. I always say too, this on the next one, when we talk about how do you get there, right? Okay, that's great. You have all those positions, you talk about all these risks, sounds interesting to me. I really want to deal with that. That's what I want to do. Right? Okay, what do I do to get there? Obviously, first one talks about getting a bachelor's degree in something IT, cybersecurity, IT related, right? Networking security, something in that realm. Is it a requirement? No. Does it help you get the job? Yes. Does it help you move up to other roles over time? Yes. Right? You will, like, if you want to move into leadership roles, a lot of time that bachelor's degree is going to be a requirement. Right? So don't short sight yourself on this. I always tell folks of like, get the bachelor's degree, get that on your file because you're going to need as much help standing out in that stack of resumes as you can get. Which then goes right into cybersecurity certifications, right? Don't take those just to get the letter, right? I'm not a big fan at all of things like boot camps for certifications because that's just helping you get the couple letters. It's not helping you understand the knowledge that this is supposed to be teaching you. On interview calls, when we're talking with candidates, and someone says, yeah, I have my Sec Plus, great, tell me about, private IP ranges and routing, things. I can't tell you, but I know there's questions like that on Network Plus and some of these other certifications, so kind of, if you have the certification, you have to be prepared to be able to talk to what the certification told you, or you spend a bunch of money on the letters and tell everyone else, like, you can spend a lot of money on a degree, and it should be a lot of money on a degree, we're not ingesting that, asking questions. Oh, Dr. Huggins left, but we talk about this all the time from the cybersecurity program here at FSW is, hey, if you're not taking advantage of the program and trying to understand the courses and the coursework and material, you're paying a lot of money for it to go right out the window. Like, you need to know that because that is what's going to help you get a job. The degree might help you get an interview. The knowledge is going to help you get the job, right? Learn cybersecurity skills. Lots of ways to do this, and it doesn't always have to be costly. There's so many free things online, right? To stay up to date on skills and events that are happening. SAMS, CISA, Microsoft, Google, they all have communications, they all have free trainings out there. SAMS maybe not so much on free training side, but
And over 10K.
Gain relevant work experience. Sometimes that's just entry level roles. I've had quite a few conversations just in the past couple of weeks with folks around. For us, when we hire and our IT recruiters here today, when we hire, we typically look large percent of time, 60% of the time, we're hiring internal, we're promoting internal for role. Right? Because I know the person, I can talk to a manager and say, tell me about this person. What are their capabilities? What's their work ethic? How quickly can they learn? Right? If I'm talking to an external candidate, that's coming from an hour conversation on the phone versus it could be a year of experience that a trusted leader in the organization can give me feedback about the individual. When I come to FSW, I ask the professor and instructor, who are the top people in the class? Those are the ones I want to talk to, right? Same way, if I talk to a leader, so getting relevant work experience means if you got to start wherever it is to get in, it's much easier to laterally once you're, or vertically, once you're in the organization than trying to come in from the outside. Right, so find the organizations that are big and you can grow them. So once you're in your foot in the door, you talk to your leader and say, this is what I want to do, help me get there. Most good leaders should help you, be fully on board to help you succeed, right? We want good folks to stay at our organization. If that means they don't want to stay in cyber, that's okay. I want them to stay at Lee Health, right? That's the important thing. I want to help them succeed. Build strong network. So events like this, right? Collaboration events, right? Like using those tools, using these events to talk, meet people, get connections, developing a security mindset, stay informed with the latest trends. This is a big thing. I can't tell you how many interviews we did where we'd say, tell us a little bit about the CrowdStrike event that occurred. Which was global news, right? And people would say, I don't know anything about that. But if you want to know, if you want to be in cybersecurity, Ben, you should be able to tell me about that event, right? That was global news. It was all over, even our local news stations. So those are, you got to stay informed, figure out what's going on, be able to talk about that, because that shows somebody who's in a hiring position or a recruiting position of like, this person really wants to do this. They're spending time to stay up to date about cyber activities now, not saying, well, if you hire me, then I'll do it. Right? It shows people that are like willing to do it, because it does take a different mindset in cyber. People want to be able to, you have to be able to be curious and want to learn and know things. Apply for jobs for interviews. So resume reviews, mock interviews, those type of things are so critical, especially for folks that are in like a college degree program, right? I've offered that up to folks at FSW before, right? That goes a long way, because a lot of times you have a few minutes on an interview to kind of sell yourself to that hiring person that why I'm the right candidate. And most times we're making that decision within a few minutes of whether we want to keep talking to you, right? Just the way it is because of the volume, how many we've done. So getting comfortable with that is key in helping you succeed in a career and be able to get those jobs that you want to get. And then the easy part, right? Then you just get experience and advance your career, and it just goes up further. Interesting. I think the other key is when you get roles, right, like building a strong network also applies to where you're working, right? Strong network within the team. Don't be afraid to ask questions. Don't be afraid to say, can you show me how to do that? I didn't understand it. Can you talk to me more? Hey, I know you're in an architect role or whatever, a different role. Like, hey, I'd like to know more about this. I don't know that I've really come across times where somebody on the team would say, no, I'm not gonna tell you. Right, and most of us had that like, most of us had it happen, or I can think of many times where somebody's saying, hey, I'm doing something like building, when I was a desktop tech, somebody says, I'm building a server, do you wanna see how it's done? Yes, I do. But the person asked me that, right, like, so most all of us wanna pass that down and provide that education and guidance to everybody else, right? Nobody wants to hoard it. So people are always willing to share information, sometimes you just have to ask that, but, that's another key that will really help once you're there, don't be afraid to ask questions. And kind of build somewhat of a mentor at organizations you're at, because that helps, even at my layer, right? I have people that I know I can go to and get honest feedback when I need help, hey, tell me about, I made a decision here, and this was it, tell me if I was, off track with this, because I sometimes need course correction on what's going on, right? I get stuck in my cyber mindset and may not always be thinking about the clinical aspect of it. So I need those folks who understand that side to be able to give me, hey, here's the real impact of the decision you made. They understand why I made the decision, right? But help them be able to do that in the future. So the same thing happens internally within teams. That's critical. And well-performing teams do that really well. Question. All right. Any other? Yes.
You have volunteer or internships available for your department?
We do not. That is something we were talking about of like, how could we create something like that? We get asked that a lot. We have limited amount of internship and it's specifically in the telemedicine, telehealth area. Not on the IT side, not on the cyber side, but we are kind of trying to figure out how could we make that work, because I think there's some benefit to both like programs that would want to be involved in and for us to be able to help bring people down. If you get the opportunity to do internships, do them, right? Because again, that's a great opportunity for you to show your capabilities. And good leaders should pick up on that and say, hey, I may not have a position for you, but I know somebody else who does. And that word of mouth goes a long way in helping you get roles, right? I've seen that happen time over time where, right, you never know the impact and what the end result's going to be from those interactions that you have. And when people see your work, when people see somebody's work ethic and they're willing to get stuff knocked out, right, it's really noticeable. Usually it's really noticeable, like that person can kick ass. We need to hire them or we need to make sure they get hired by somebody. Yes.
One thing I didn't really see you touch on too much, and I've been seeing it a lot, thinking about it, now to speak more about it, is these patient and provider portals. A lot about infiltration and exfiltration to those. Have you seen a lot of it going on with that?
Yes, so that's been another top. So threat actors aren't just trying to compromise the entire data set, right? They're going down to the individual patient level now and saying, hey, I'm gonna try and get my chart account, right? That one person, not all my chart accounts or a chunk of them, right? They're going for individual. So you're starting to see them go at a much more granular level. I think that becomes much harder because like they have to really, to get a lot of value out of that, you have to do that in scale. It becomes very difficult. But again, it goes back to what I talked about at the beginning of the value of one PHI record. And as long as there's value in one PHI record, there's value in them targeting one person, random person to get their medical information. So that's something we've had a lot of conversations with our EMR vendor about and a lot of other organizations just around better ways to help detect anomalies and things like that. Because it's patient portals is really difficult because you have patients that can gain access from anywhere. We have people from Canada and out of state and out of country all the time. Right? So that it's not abnormal to see somebody accessing from outside of Florida those patient portals. So how do you confirm whether that's legit or not? It gets a lot more difficult. Layering in things like password management, MFA really help, right? But that's not gonna solve all the problems in it. Yes. Yes,
You mentioned career opportunities. What cybersecurity roles do you guys offer at Leap Health?
we have. Good question. So we have security analysts, and we have a couple different layers of those, kind of tiered of security analysts depending on the level. So it starts as like an analyst 1, 2, and 3. So analyst, advanced analyst, senior analyst. We also have security architects. So those are the folks that are, you know, developing how the firewalls are implemented and deployed. Other key critical systems of like cloud infrastructure that's being implemented, right? They're kind of coming up with that design and considerations, working with vendors, a lot of project related work, a lot of projects for implementing new security controls that we would move about, both driven from cyber and from business areas. We have leadership roles. We also have a GRC side of stuff. So we have analysts that are responsible for security awareness and education. We have folks that do third-party risk management and also do insider threat management, DLP, and governance, risk and compliance, or GRC. So more of like coordinating audits, risk documentation, policy management, those type of things. So and we continue to grow that. So that's, you know, we've added quite a bit of staff in the past 18 months to have key people designated in those areas. We expect that to continue to grow.
You guys have remote opportunities?
Yes, so for us, the technology roles are full-time. As long as you're in Florida. You gotta be resident. Sorry, I got some BJ. Yes.
I'm straight from Michigan. So.
Any other questions? Yes.
Wait, what, so the skills you need to have for cybersecurity analysts?
Oh, boy.
What specifics? So.
Yeah, well, yeah, like, no, they don't like.
So actually, so we have a lot of our analysts in the room. I would like for them to answer that question. Because it comes better from the people doing the roles that are there versus. Any of our analysts, would you like to speak?
What was the question?
Paying
attention.
Paying attention is the first skill.
Like a day in the life, or like what's like your skill set that you need to like succeed inside the role? On the day to day. For workers in cybersecurity.
Attention to detail is a lot.
Yeah.
You don't really have to pay attention. You have to pay, you have the detail of the logs that you're looking at, yes, the people around you, you kind of like, it's got. Ignore them, but you know that's out.
Well, let me ask, like coming into the role, is there something you wish like, hey, I would have. Focused more on these specific technologies things now that I know what's expected of the role being in it, right? Like networking, those type of things.
I would just say a good foundational knowledge of some of those things Brian just mentioned. You know, a foundational knowledge of networking. You don't have to be an expert, a CCIE, anything like that. You know, domain administration, you know, Active Directory, just a basic knowledge of those sorts of things. And again, you don't have to be an expert at them. But a baseline knowledge of, familiar with what they are, you know, what their purpose is.
And then the rest you learn on the job?
Yeah.
Okay.
Trial by fire.
Yeah.
Platforms or platforms.
Asking a lot of questions.
I would say one of the core things, right? Like, so core networking is a key, right? The common joke is we love to blame networking, but at the same time, you have to understand to be able to blame them. So, but that like out of like network plus type thing is really helpful because even if you're not doing something, even if you're doing system administration, core networking is really useful in almost any IT room.
I would say that required.
Yeah.
I'll
It is
go,
fine.
I'll go a
So
step
you'd be
further.
a good analyst, you're not gonna be good at networking, but.
And this
They
is
understand,
like
yeah.
go,
Yeah.
like being able to go develop,
Yeah.
go install a router or switch, right? That it's just how does networking flow across the network?
Right.
What are common ports? Right? Like what does DNS talk over? Because when you're code logs.
You have to know enough to understand what's abnormal.
I'll put it,
Yeah.
I'll put it a slightly different way. Know how things work, because then you can know how things break. And that's ultimately what you're looking for, is you're trying to determine what is not normal. But if you don't know what normal is, it's really hard to tell what abnormal
I equate it very similar. If you ever looked at the Windows event log on a device,
Yeah.
does it make sense?
No.
Exactly, because you don't look at it the first time, you're like, what the heck is all this? What matters, what doesn't?
Yeah.
Go look at
Hey,
go look at the SIM events, right? Go look at the SIM events. Same thing, it's just like crap ton of event flow. You're like, okay, what should I care about? What shouldn't I? So you kind of like, you have to get familiar with event logging, right? Like of what to look for, what's typical and what isn't, what to stand out, because it's really easy to go down a bunch of rabbit holes and you're be researching something. This looks odd, and you spend a ton of time to find something to go.
The devil's
This
in
is
the
okay.
detail.
But the big thing I missed this really critical thing that I should have
Yeah.
spotted right away and figure out 10 minutes. I will make sure you get the shit answered. But
I'm just to piggyback off of what he was saying, would you say having some knowledge of SIM and maybe SOAR would help as well?
absolutely,
Into it?
absolutely. If you're applying for a security analyst role, we're gonna ask you.
Yep.
Right? We're gonna ask, yes, anything on here, right? Is likely you're gonna get asked about these type of things on an interview as well. You don't have to be an expert, right? But you should at least be able to say, I know what a SOAR is, I know what it's used for. Maybe you haven't dealt with it before, but again, like as a hiring manager, I would understand if you have no experience, I wouldn't expect you to have dealt with it before. But as somebody who's interested in cyber and has a cyber degree, you should be able to talk about that.
And what would you want to try
We
to
temper
do?
the expectation.
Right, what would you want to try to do with this MR sword? What are you looking for? Right, so being able to throw out an acronym, great, that's helpful, but what would this allow you to do functionally? What are you looking for? Right, so again, think about that from a logical perspective. The other greatest piece of advice I can give you is if you are going through whether it's classes, whether it's certifications, whatever, if you're reading or you're in an interface and you're doing a thing and you don't know what something is or does, figure it out. Go look it up, right? So you may be doing a lab and it says click here, but let's say you do a packet capture and you see something in there for in our request. You know what that is?
Packages.
Well, I don't need to answer, but
I should have mentioned, this is Matt, he's our cybersecurity manager who the stock reports up to.
I have opinions.
No. Oh, third.
Wait, what is easy now?
Electronic dance.
We have that.
Yes, good. Gone.
That one would work out.
The mountain was things up.
Oh, really?
Yeah.
You don't like that.
I can't remember what.
Yeah.
Sponsor. Yeah, I don't like. I don't want to. It was ransomware.
Well, we said, look at it, and afterwards I'll craft it up.
Good job, Matt.
Yeah.
Answering the questions.
No.
Good.
Appreciate it.
Yeah.